This is a hip procedure on a runner who has hip instability and a lot of clicking, popping in the front of the hip. I believe this patient has a labral tear along with ligament injury. Here I'm treating the anterior part of the hip, which includes the labrum, the greater trochanter, the anterior portion. There I'm poking on the greater trochanter. But the gluteus minimus is treated. Here I'm doing the side of the hip, including the greater trochanter, where you would get various attachments of the ligaments and muscles that attach there, including the gluteus medius. In the front of the hip, obviously, I'm also getting the pubofemoral ligaments and the iliofemoral ligaments. Here, from the posterior approach, I'm going to inject some proliferant within the hip joint itself. And then, of course, we're going to do all the attachments in the posterior part of the hip. And that, of course, is going to include, the ischiofemoral ligaments, more of the iliofemoral ligaments. You're obviously going to get, some of the smaller muscles too, including the obturator, the piriformis attachments, onto the greater trochanter. Hip problems, just are ubiquitous. The hip ligament injury or hip instability is actually the cause of degenerative hip disease, and it's the reason why folks have to get hip replacements. So prolotherapy, if we utilize prolotherapy as it should be, there would be a lot less people getting hip replacements and knee replacements. The time to get treated is early on. This athlete is training for a half marathon and doesn't want to have their training regimen stop because of this injury. And believe it or not, within 10 days of this treatment, the athlete was back to running. Now, they are going to get another treatment. They are scheduled to get another treatment. So it isn't like one treatment resolved it, but definitely the athlete's back to running. So depending on the injury, we can get people sometimes back to their sport really quickly. Sometimes it takes a few treatments before they're back to their exercise. But you can see the whole treatment, takes very little time. And obviously the hip joint is treated thoroughly from the front, side, and back.